Today I will be talking about my fourth day of summer practice. Today we also followed the ambulance. Um, I went with the same ambulance as before, ambulance number 5, with the same brigade and team. Today I partnered with a Russian student also. So we went to 3 houses. First, we went to the resting area and waited. The first shift, it started with the first patient where we went, and she was having hypertensive crisis. So the doctor took her background, did ECG, and also talked with the patient and with the medication she was eating. And the doctor made a appointment for the patient with the hospital. She also gave injection of multinutrition, and then the patient was feeling well. She could talk well. She was just having symptoms of not breathing properly and dizziness, and when we checked her BP, it was very high. So that patient, she was supposed to go to the appointment and then take her refill of medication. The second house, we went to a patient who was complaining about pain in her lower colic area. She had a history of pyelonephritis, and the pain was at the same part of where she had pyelonephritis on her left. The doctor took her background, did palpations. She did not find any. It was not appendicitis because it was not Schepkin-Blumberg sign. So the patient required the doctor asking for them to make an appointment. So the doctor then decides to take the patient to Besempe, give her a more thorough examination right away. So we took the patient to Besempe in the ambulance. The patient also complained of nauseous, fatigue. She had very flushed red face, and when we took the temperature, she had a 38 degrees Celsius temperature, so she had a high fever. We also did COVID test, RTK, at her house, and we used gloves for prevention of transmission of if in case it was corona. The test result was negative, and then we sent the patient to the hospital. For the third patient, someone called the ambulance saying that they found a girl in the playground. So when we went there, there was a 16-year-old girl lying on the floor. She took a lot of alcohol with her, and she was sleeping at the time. Then the paramedic went and woke her up. They had to wake her up a few times. They put alcohol, like sterilizing alcohol, and then put it on her cheeks for her to wake up because of the icy feeling. So when the paramedics and the doctor asked where she is, who she is, what's her name, her background, she couldn't remember. So they took her into the ambulance, calmed her down because she was in a very frazzled condition, and she was not in a good condition. She looked like she was crying for a long time. So the doctor calmed her down inside the ambulance. We took her complaints. She had only dizziness, and maybe it was from the hangover from the amount of alcohol she consumed. And then we tried to ask her her information. We tried to take her mother's contact number. We ended up finding her sister near her residential area because she only remembered where she lived. So we found her sister. Her sister took a hold on her, and then they went back. At 3 patients, we went back to the resting area, and then it was abed time. It was lunchtime. And then after lunch, I went back because it was already 2:30 at that time. I really had a good day today, and it was a very eventful day also. I learned a lot from the doctor and the paramedics, and I am looking forward for more.